I'm going to demonstrate to you today how to do trach care cleaning, and after you suction your patient, you will get your trach care tray out, get your hydrogen peroxide and your sterile water. So if they've been opened before, you want to open your lids, lay them face up like this on your table, and pour over the label to cleanse the spout. If they haven't been opened, you don't have to do that. This one's been open. We're going to pour over the label to cleanse the spout. Now you would not pour over a label on medication because it could distort the directions there, but on water, peroxide, you can do that. Okay, now we're going to open this up, and at this point, just to take this off, we can put on some non-sterile gloves just to take the old dressing off. And I don't have to put them on Sterile Technique. And I may need to loosen this Velcro, or I can just slide it right off. Sometimes the dressing is pretty clean and sometimes it's really messy. Once you finish that, put it in your hand and put it in your other hand like this, throw it in the trash. Now be really careful to get your gloves out Sterile Technique, and you can move this around from the outside but don't touch it from the inside because it's sterile in here. Now these gloves go on sterile, and when you're working with a real patient, you are not going to be using your bed as your surface. You're going to be using your bedside table. Remember, under the cuff for Sterile Technique for your gloves. Okay, at this point we can pull out our equipment and see what we have. This has a shiny side and a flat side, so I'm going to put it right down here so I can get my equipment out here. See what we have. Okay. And you can touch this on the inside because your hand is sterile, but you can't set it on here because this is unsterile and it will contaminate it. At this point I'm going to go ahead and designate my unsterile hand, take my peroxide bottle, and I'm going to pour peroxide here, and I'll pour some peroxide here, and I will pour some sterile water. Okay, with my sterile hand, I'm going to take the inner cannula of the trach and I'm going to drop it in here and just let it sit for a minute while I'm cleaning the outside. While I'm cleaning the outside, if I need to use peroxide, I can just dip it in this other peroxide, and I work from inner to outer, so around the area to the outside. And then you can use the opposite side. Cleanse it from inner to outer. And then you would go around your sterile field and drop it in your trash can. You can use this a couple times, but always when you finish with water instead of peroxide. And you can do this on the top side too if you need to. Okay, now at this point you will take your brush and you will cleanse out the inside of this really good. And rinse it in your sterile water. And you don't want to put it in the patient with water in it, so you want to turn it over and tip it. And then you can take your pipe cleaner and clean out the inside of it here. Let it come through. And now it's ready and dry. If you have another 4x4, or if you haven't used both of them, you can dry the outside of it. And you're ready to put it right back in the patient. And at this point you can get your new slit dressing and loosen one of these sides And you don't want to loosen both sides at the same time because you want it to stabilize on the patient. So loosen the side up and then put it back together. It's a pretty easy thing to do. Makes the patient feel a lot better. And this right here is a temporary trach holder. So if this bigger one is soiled, the Velcro one is soiled, you can put this on and you just tie it on one side and then you put it around the neck and tie it on the other side. So that's what this is for. It's a temporary holder. And then you get all your trash and throw it away, and there you go.